Good afternoon and thank you for joining us. My name is Tina Tebow and I will be your moderator for today's COVID briefing. Joining us today, the Honourable Iain Rankin, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. So we are reporting one new case today in the Central Zone, and we continue to manage two clusters, one in Glace Bay and one in Halifax. All of those cases are connected to a family and there is no sign of community spread. Our vaccine program is rapidly rolling along. As of today, 75% of all Nova Scotians either have their first dose or are booked for one, and we're moving on to second dose bookings. All appointments for those eligible have been moved up, so you will now be notified to get your second dose sooner. And our walk-in clinic at the Halifax Convention Centre has moved on to second doses as well. If you haven't received your first dose, you're welcome to go back to that walk-in clinic to get it. I want to thank everyone for their cooperation and their willingness to get vaccinated. Just yesterday, 1,400 Nova Scotians received their first dose. We know that not everyone can be vaccinated either for health reasons or age, and that's why it's so important for those of us who are eligible to get those 2 doses. We're all in this together and we have to do our part to protect ourselves and those around us. And before I hand it over to Dr. Strang, I wanted to take a moment to talk about the masks we're wearing today are actually from the Antigonish Highland Games Society. And every year the Society puts together the Highland Games for a celebration of culture and athleticism. And that's been going on for a long time. Unfortunately, the Games have been suspended again this year due to COVID. So we wore these masks today to support the Society in hopes that in the Highland Games in 2022 will be the biggest one yet. So with that, I'll turn it over to Dr. Strang.
Thank you, Premier, and good afternoon, everybody. As the Premier said, in terms of cases, not a lot has changed since Monday, and we continue to follow the clusters in Halifax and Glace Bay, and there have been some new cases associated with those in the last couple of days. But fortunately, there are still no signs of broader community spread, but we continue to watch both these clusters and watch for that carefully. And we do have great news on the vaccine front. As of today, 75% of all Nova Scotians have either received their first dose or are booked to get it. And hundreds of people are still getting their first doses every day, which is really encouraging to me. Yesterday, 1,400 people did just that, and these are numbers we need to see continue. We're also adding over 8,000 fully vaccinated Nova Scotia residents who are military members to our records. While they aren't included in our totals just yet, they will be added. They will add at least another percentage point and push us past that 75% minimum target for first doses. So this is a milestone worth celebrating, but we can't stop yet. 75% of the entire population with at least one dose is our minimum. While we've shifted focus to second doses, we still want as many people as possible to get their first dose and then their second. The more people who are fully vaccinated, the better protected we all are from COVID and its variants, especially the Delta variant. And this Delta variant is causing outbreaks in Canada and in other countries. We need every eligible person to get both doses of vaccine to help protect us all. The sooner we do that, the sooner we can lift more restrictions and public health measures. And some people are asking when we'll stop public health measures, especially about wearing masks. And honestly, the answer to that is really up to all of us. And as we reopen, we take on more risk. Until at least 75% of Nova Scotians have 2 doses, measures like masks, especially indoors, distancing, and testing need to continue to protect us. We can't remove this layer of protection, the public health measures, until the layer of 2-dose vaccine coverage is strong enough. If we boost our vaccine coverage rates this month, we may be able to reduce some of the public health measures and move into phase 5, which is living with COVID, sooner than we've hoped. However, other places in Canada and elsewhere are beginning to lift restrictions, and we need to watch them carefully. The UK just announced its plan to fully reopen in about a week. But when you read the UK announcements, they acknowledge that they're taking on significant risks. They are expecting significantly more cases and hospitalizations. The Delta variant accounts for most of the cases in the UK, and they do not have high enough two-dose coverage in their population by their own acknowledgement. And the US also provides us a very instructive example. There is increased spread of the Delta variant in relatively unvaccinated parts of that country, and there is a clear link now between lower COVID vaccination rates and more COVID deaths by state. As Mississippi State Health Officer says, it is the unvaccinated people who are being diagnosed, who are going to hospital, and who are dying. And that's not a risk we are prepared to take in Nova Scotia. Our people, our healthcare system, and our economy have been through enough. So we'll continue our cautious approach to reopening while we increase our vaccine coverage. And today, the last group of Nova Scotians will be invited to move their vaccine appointments forward. Anyone who received their first dose on or before July the 6th will get an email in the next few days to reschedule their second dose. And those who get a first dose on or after July 7th will automatically get an email to reschedule their second dose 28 days after the first. And to date, about 3/4 of people have rescheduled to get their second dose sooner. We are still in the race against COVID-19 and the Delta variant, and the sooner we're all fully vaccinated, the safer we are. So as I said on Monday, do not delay getting your second dose. And also, mixing the types of mRNA vaccine you get is perfectly okay. As part of the celebration of hitting our minimum target of 75, I have a few thank yous today. Yesterday, we started offering second dose walk-in appointments at the Halifax Convention Center Clinic for those aged 65 and older. And today, we're opening it to those 50 and older. And our goal is to make sure all available appointments for the walk-in are booked every day. So I want to thank Public Health, the IWK, the Red Cross, and the Canadian Armed Forces staff for pivoting to try something new at the Convention Center. It's working. I also want to thank pharmacies and the Pharmacy Association of Nova Scotia for their partnership and leadership. As of today, we've delivered about 500,000 doses, that's half of our vaccine, through community pharmacies. And in addition to pharmacy-based vaccine clinics, pharmacists have supported off-site clinics for temporary foreign workers, long-term care residents, day programs for adults with disabilities, faith-based clinics, and more. Their flexibility in dealing with an ever-changing supply and delivery dates has been hugely helpful. And I also need to thank the many vaccine planners plus community clinic immunizers and support staff. Without them, none of what we are celebrating could have happened. You have all stepped forward to serve Nova Scotians, and we owe you a huge debt of gratitude. And to the many frontline workers, those in our hospitals and long-term care homes, those managing cases, doing contact tracing, testing, running specimens in the lab, thank you all. You have been instrumental in achieving the milestone we're reaching today. But I want to end by thanking Nova Scotians. Since March 2020, you have followed the rules. You've stayed away from friends, stopped hugging loved ones, worn your masks, gotten tested, and now you're getting vaccinated. I wore my Nova Scotia tartan tie today to recognize the people of this province for coming together to roar back against this virus. What we have accomplished is nothing short of amazing. It's been hard, but the way we've pulled together as a community is something to be very proud of, and something other places have come to admire. I came to Nova Scotia in 1999, so I guess I'm a come from away, but I consider myself a Nova Scotian, and I feel privileged to be part of this amazing province and its incredible community. And so I'm going to leave you with two important requests, a personal appeal from me. If you haven't had your first dose, book it. Even if you're not worried about getting sick yourself or making somebody else sick, or want to wait a bit longer to learn more, please book your appointment now. There are people who need your protection. There are also things that will be easier for you if you're vaccinated, like travel. And if you haven't moved up your second dose, please do it now. The sooner we're all vaccinated and the sooner we can loosen restrictions and public health measures, the sooner we can get on with our post-pandemic lives. Tina.
Just say, when you mentioned privilege to be here, it certainly is a privilege on behalf of Nova Scotians to have you here and have you here as our top doctor to get us through this difficult time. And it's a privilege to work with you, really.
Thank you, Premier.
We'll take one question, one follow-up from reporters in the room, and then we'll go to the phone lines. We'll start with Preston Mulligan from CBC. Go ahead, Preston.
Hi, my question is for the Premier. Premier, I'm sorry, I know you've been through this morning, but I need to ask you why you're reluctant to say directly back in the early 2000s, in your second DUI, whether you were drunk. Why can't you answer that question directly?
So I laid out the facts of both incidents when I spoke on Monday. Regrettably, I made a bad decision, and in 2005 there was an incident, and it followed the right process. The courts made their determination, and I moved on and changed my lifestyle. I have a much healthier lifestyle now, thankfully, and it's a privilege to be able to be in a position I am in now, and I'll continue to work hard on behalf of the province.
Go ahead with your follow-up.
Question for Dr. Strang is, one of the demographics that you were trying to hit was that 17 to 30-year-old. What kind of dent are we making in that demographic, and are you satisfied with it?
We still have some work to do, but we are seeing an increase in that. Many of our first dose appointments, we've hit 80 or up to 90% in some of the older age demographics. So many of our first dose appointments are those younger age groups. They are coming forward. We continue to grow. Still more work to do, but we are making progress. And our what we're celebrating today is a reflection of that. We're 75% of the entire population means 85% of those who are eligible. That's a lot, but we still have more to do. But those young people are, by and large, the ones coming forward now for their first dose vaccine. So I thank them for that.
Next, we'll go to Paul Bacon from allnovascotia.com.
Premier, have you received a legal opinion that would prevent you from answering the question about whether you've been drinking on the morning of July 25th, 2005?
No, I haven't sought legal advice. I'm just telling everyone what my story was 18 years ago.
Go ahead, Paul, with your follow-up.
Dr. Strang, some people, I guess, who had rebooked their second appointments had been turned away. They couldn't find a record of it through online bookings. Do you know how prevalent that problem has been?
I don't know. I think the vast majority of people are booking and getting their records there, and there's small numbers of people, and if they bring forward and we support them, we even I'll tell a story that one of the staff in the vaccine clinic, there was an elderly couple this weekend who was having trouble, printed off their vaccine record and delivered it to their home. So we have people going to extraordinary lengths to help people in the small cases where they're having trouble getting their records.
Next, we'll go to Tim Bousquet from the Halifax Examiner.
Dr. Strang, I don't want to ask the Premier about his DUI, but since his statements, he's been criticized for politicizing these briefings, and that gives me the excuse to ask you something I've been meaning to ask you for over a year. And that's, I wonder if you are aware of the U.S. Centers for Disease Control's advice on public health messaging, which says that politicians should not be the face of the messaging, and that instead it should be public health officials who are trusted, like yourself. Obviously, Trump violated that messaging, and we've seen what we've seen. I wonder, though, if you have any thoughts on that. Is it appropriate for the Premier to be using these briefings for political reasons?
So I think what we have is a very well-established partnership that established first with Premier McNeil, now Premier Rankin. I give the Premier public health advice. Ultimately, the Premier is elected to make decisions, so the two of us together are speaking to Nova Scotians. And I'm very fortunate to be in a province where the Premier has always continued to put the health and safety of Nova Scotians first. So us coming together, speaking to Nova Scotians, I think has worked very effectively as a blend of elected leadership as well as strong public health expertise and advice.
Go ahead, Tim, with your follow-up.
On the subject of politicization, a public health order was issued to prevent an anti-mask rally on Citadel Hill, but that was also used as an excuse to arrest people in a pro-Palestine rally. It's my understanding that many people in the Muslim community, including those in the Syrian immigrant community, understood that they considered themselves to be political targets of public health, and that in turn has resulted in distrust of public health among those groups. Do you think the arrest of the Palestine rally has led to resistance of public health's calls for vaccination?
Not that I'm aware of. We are working very closely for the last couple of months with our Muslim communities, and we've specifically had vaccine clinics at some mosques. We're working with imams at specific mosques, especially some of our newly arrived people who are of Muslim faith, to make sure that we have culturally appropriate, language appropriate information on testing and vaccination. It was not a public health decision. Actions taken by the Halifax Regional Police against those demonstrators. That was a policing decision. But we continue to work very closely with all Nova Scotian groups, all communities, including our Muslim communities, around ensuring everybody has good access to information, access to testing, and access to vaccination.
We'll go to the phone lines now. We'll take our next question from Elizabeth McSheffrey with Global. Go ahead, Elizabeth.
Thank you. I know we're celebrating the 75% mark today, and I promise I'm not trying to diminish that. But I just wonder, Dr. Strang, if every Nova Scotian who is eligible to get a shot went and got their first shot when they were called, do you think it's possible we could be at 100% by now and in a further stage of reopening?
No, I mean we've had some limitations over the months with the vaccine supply. We have never had excess vaccine sitting around that we would have been able to, in any significant way, increase the number of people who are immunized within a certain period of time. So we are where we're at. Thankfully, the vast majority of Nova Scotians continue to come forward to get vaccinated, and we continue to use all the vaccine that we have in a timely manner. But we are far advanced in our thinking and our outcomes than we were when we started immunizing in December 15th. We felt it was going to be mid to late fall by the time we got to a 2-dose coverage. Now we're talking about late August. We've made huge incremental increases decreases in the time frame of delivering our vaccination.
Go ahead, Elizabeth, with your follow-up.
Thank you. And Premier, at this stage in the pandemic, many families of folks in long-term care say their loved ones have suffered irreparable mental and physical health degradation and may even have shorter lifespans now as a result of what they've been through. They say that the free will of these Nova Scotians in long-term care homes has been taken away. So beyond improving sector infrastructure and funding, will you do anything to address those individual harms and the damage that's taken place? Or will these folks just sort of have to live with it and move on once long-term care homes completely reopen?
There's a lot of lessons learned through the course of the pandemic, and one of them that stands out for me is the long-term care sector and how isolated senior populations have been for a long time, more so than other parts of our population. And so unquestionably that's going to have an impact on people, and we need to do more than just invest in the buildings to bring them up to today's standards, and more than just invest in staffing and ensure that staffing gets a more appropriate wage so we can attract more CCAs and other professions that are involved in the sector. We need to do all those things, but we need to do as much as we can do to assist those and ensure that they're being listened to. And so that's part of what the work is that's underway with the recommendations from an expert panel. But no question, there will have to be a long process after this pandemic to look at all of the impacts across our society, and long-term care is one of those that stand out for me.
Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Thank you. Just along the long-term care home questions, Dr. Strang, there are 3 categories of people who live at facilities like Northwood, and one of those categories is tenants. and some people feel that the tenants are falling through the cracks and still facing restrictions while restrictions are being eased for residents of long-term care. Is this something public health is looking at?
So we're looking at in general for the continuing care sector. We're at each phase of our reopening, and part of our phase 4 reopening will be further relaxation of and increase in ability for visitation and movement of residents. At the end of the day, these are private facilities, and we give guidance, and it's up to them to adopt or not make decisions for within their own facility. But we give general guidance, and we don't distinguish between whether it's a licensed long-term care facility versus a private seniors residence.
Go ahead, Natasha, with your follow-up.
Thank you. I just want to clarify something. I know there was one new case today, and the language in the press release today said that all 4 health zones are being closely monitored for community spread. So does that mean we're no longer seeing community spread in the Halifax area?
Exactly. We're now at a space where the cluster in the Halifax area is confined within a fairly closed population, and continue to see expected new cases in groups where we know that there's close contact. But we're not seeing any additional cases outside of that would suggest that we have ongoing community spread. That's good news. But we still have COVID around us, and we still, as I said earlier, we still have some COVID activity in Nova Scotia. We've got more people coming in with COVID, so we still need to remain cautious as we continue to reopen through July and build our high 2-dose vaccine coverage.
Next, we'll go to Michael Tutton from the Canadian Press. Go ahead, Michael.
Good afternoon, Premier. Would you feel you should wait until Phase 5 before you call a provincial election with all of the contact and flow of people that would involve?
Well, we're getting safer and safer day by day, and I still continue to focus on getting through Phase 3 right now. We're still not at the point where we can guarantee the start of Phase 4. So I'll have more to say once we get closer.
Go ahead, Michael, with your follow-up.
Dr. Strang, and I think the Premier, but it's New Brunswick's level of second doses is 43%, and forgive me if my math is wrong here. I have not my forte, but I think we're at 40 or 31% in Nova Scotia. It's quite a large difference between 2 Atlantic provinces. What are the primary reasons for such a large difference?
The main difference is because New Brunswick, like many other provinces, they report the percentage of people who are eligible for vaccination. The last I looked at it, we're very close to New Brunswick. We do that, but the virus doesn't care whether you're eligible or not. So to me and my colleague Dr. Deeks, it makes much more sense that we report on the percentage of the total population that is protected by vaccination, and so that's the number that we give. So that really explains the difference. We're using different metrics to actually report. But when we've done it internally, when we look at usually the metrics that other provinces are doing, we're up there, and we certainly lead the country in the percentage of population that has at least 1 dose, and we're in the middle of the pack now for the percentage of the population with 2 doses.
Next, we'll go to John McPhee from the Chronicle Herald. Go ahead, John.
Thank you. This is for Dr. Strang. When you look at the booking site, there's basically zero availability for Pfizer. Quite a few places you can get Moderna. For example, there are about 70 appointments open for Moderna just at the convention center for each of the next 3 days. I'm just wondering, are you worried that people aren't getting the message you sent out the other day that Moderna is just as effective as Pfizer?
Well, we're still getting good uptake. Our vaccine clinics are full, so that to me tells me that people are hearing the message, and by and large they're not waiting. But it's really important that people, I've said today and I said it on Monday, that there's no need to wait. That if your first dose of vaccine was Pfizer, don't wait for a Pfizer. Wait for get whatever vaccine you can get as quickly as you can. The 2 vaccines are equivalent, and they're safe and effective, and there's no reason to not take whatever mRNA vaccine is available to you first.
Go ahead, John, with your follow-up.
Thanks. Yeah, so I'm just wondering, are you worried that there's a possibility any of our Moderna supply will expire, given the apparent Pfizer preference, and how long do these supplies last?
I don't have it in front of me. They have the exact expiration date. It's fairly robust and long term. We have lots of Moderna right now. That supply is a bit unstable, but everything that's been projected, we have lots of Moderna, and then we have the real issue right now is for this week and next week we have a short-term notice that we're getting less Pfizer than we were expected. We are going to get much more Pfizer, and by the last week of July we'll have a backup with our robust supply of both Pfizer and Moderna. So it's a short-term issue for this week and next week around less Pfizer than we'd hoped for.
Next, we'll go to Chelsea Gould from the Truro News. Go ahead, Chelsea.
Hi there, this is for Dr. Strang, just echoing the last question. From what I've seen in some parts of the province, clinics are nearly all booked up, both Pfizer and Moderna. And there are still people who had their first shots earlier looking for any openings they can get to reschedule. Should this be a concern for people trying to get their second shot within the recommended time frame, I guess, for vaccine effectiveness?
So, I mean, we want people to get immunized as soon as they can. We have limitations on how many appointments we can put out in a given week because we don't put out more appointments than we have vaccine. And we've had some fluctuations in vaccine supply that I just talked about. So we want as many people as possible, and people are. It's great to hear that appointments are filled up. And if people are having to wait for a bit, that we just ask for their patience. We are going to get through this big the surge and finish up our first dose and get as many people as possible with second dose in the next few weeks. So if you can't get an appointment right away, we know we're going to get much more vaccine supply. So keep looking on the website, keep looking, and get the first available appointment that you can get.
Go ahead, Chelsea, with your follow-up.
Okay, thank you. And looking at the people who are looking for a first dose and perhaps they see that the clinics are booked up, could that be a concern as well, especially in places that don't have walk-in clinics like Halifax?
Well, we do have a walk-in clinic, and Halifax is not the only place where we're having some walk-in clinics. We have walk-in clinics in a number of communities across the province, and we continue to look every day. We look at a very local level what our vaccine uptake is, and so I use the example. Last week we saw that there were some parts of Western Zone and Annapolis Valley that we needed a bit more attention to get their vaccine rates up. We moved in and we held temporary vaccine clinics at fire halls and things, so to make sure that we were addressing some of those access issues. So we're not static at all in our planning. We continue to look both by age group and also by pretty local geography about where we might need some additional support, and we divert resources and vaccine around the province to help make sure that everybody has timely access to both first dose and second dose.
Next, we'll go to Victoria Walton from the Coast. Go ahead, Victoria.
Thanks. This question is for Dr. Strang. You said that we'll have 75% of the population with first doses, but the Premier also said that Phase 4 isn't yet guaranteed to move into on the predicted date of July 14th. Will we hit that 75% by July 14th? Currently, we're at about 73.5, and we're looking at needing to get about 2,400 first doses into arms every day for the next week to hit that. Do you think we'll get there? Will we have to delay Phase 4? Would we move ahead if we're only at 74.5%?
Well, today we are at 75%. We explained that we have a chunk of data coming from our military colleagues, which is just going through the process of data entry to get so it appears on our provincial dashboard. But we know we know the numbers that are in there, and that adding those numbers gets us to that 75% target. But that's just a target. That's a minimum target. We need to keep adding and building on that every day. While we're celebrating that today, we can't kind of take a sigh of relief relief or a breath of relief right now. We still have more work to do, and people who have had no vaccine or have only had one dose of vaccine, we need them to keep coming out and rolling up their sleeves. We will have vaccine for you, and we'll have lots of ways for you to access that vaccine.
Go ahead, Victoria, with your follow-up.
Thanks. And Dr. Strang, I also just am looking for some clarification on the military members who are now included. I guess, were they not included before just because the numbers hadn't gotten in yet? Are these people who were just recently vaccinated? Or are they people who aren't really part of the general population? They're kind of isolated, staying on base, and that's why they weren't included? And if that's the case, why make the jump to include them now?
No, so that at a national level, the decision was made by Canadian Armed Forces to run their own vaccination program. So they've been doing that for the last few months. It's personal health information, so we needed to go through some steps around privacy, legal, so we could share that information, and that takes a bit of time. So what we're saying today was we know what the numbers are. We're going to the very last final steps to validate those numbers and be able to incorporate them in the provincial numbers. Those are Nova Scotians. It's just that they had a separate Armed Forces-led vaccine program, and we haven't been waiting. We're now at a point where we can incorporate their data, and that's good news because they're part of our population. They need to be accommodated when we look at our total population numbers, and we're almost able to do that. But knowing what the numbers are, we can reliably say that we are now at that minimum 75% target.
And that's all the time we have for questions. Go ahead, Premier.
Thank you, Tina. Dr. Strang and I used this time to talk about the importance of getting vaccinated and following protocols and getting tested. Well, 3 Nova Scotians Mi'kmaq musicians found a way to answer the call. Singer Emma Stevens from Eskasoni First Nation, fiddler Morgan Toney from Wagmatcook, and hip-hop artist Todd Gugu from Waigoma First Nation, otherwise known as Shift from the 102. All collaborated to write a poem, perform a song, and called Willalan, which means thank you in Mi'kmaq. The song has a positive message about hope and healing and encourages people to protect elders and their communities by getting the vaccine. The music video was shot in Waigoma First Nation, Wagmatcook First Nation, and Badek, and features family members of the musicians. It was directed by Stephanie Jolene, an Indigenous director from Nova Scotia. It is a beautiful song with some wonderful images, and I encourage everyone to listen and share it with friends and family, and I'm proud to share that with you here today.
teachings spoken by my elders. Let me see the wisdom through this eagle feather. We all sit in a circle, so let us come together when the truth rings out. Spiritless forever. Will I live? Will I live? Will I live?
Yo. So do it for my hometown, my people, my family, friends. You gotta do it, yo, I do it to protect you. My kid, my grandparents, friends with the baby school. Son asked me, go stop it on the track. We gon' do my best and he don't know. Yeah, got my shot and I'm dead glowing. Yeah, can see the bright light at the end of the tunnel. Future looking bright, we can get back along.